Greetings everyone. Today in this video, I'm going to talk about a friend of mine who is taking a particular medication known as cetirizine dihydrochloride. So you may be wondering, what is the use of this drug? Cetirizine dihydrochloride is used to treat allergic reactions such as itchy eyes, hives, and runny nose. It is considered as a non-drowsy antihistamine and it prevents sleepiness. Common brands include Benadryl, Zyrtec, and Claritin. Instead of me telling you all the facts of this drug, let me show you a conversation of two friends who is talking about cetirizine dihydrochloride.
Hello, I saw you taking medicine just now. Are you sick?
Oh, it's for my allergies. It's an antihistamine drug called Cetirizine dihydrochloride.
Oh, wow, I never heard of a drug like this before.
I had to take a pill because the dust and pollen here is making my eyes itch and my nose runny. I can't even concentrate on my work anymore.
Oh, I didn't know you had allergies like this. Are you feeling any better after taking the medicine?
Yeah, I'm feeling a lot better. Just feeling a bit of headache and dry mouth.
Does this drug makes you feel sleepy?
I am feeling a bit drowsy, but it should be fine.
Oh, aren't there a lot other antihistamine drugs out there? Why don't you try other types that don't make you feel sleepy?
Oh, I heard of those, like loratadine. They take as long as 3 hours to take effect. My drug takes 1 hour to take effect.
Oh, I see. It is better to stop sneezing as soon as possible.
After watching this short video, let's talk deeper about what is this drug about. Firstly, the pharmacokinetics is the study of what the body does to the drug, where it focuses on absorption, distribution, metabolism, and excretion. These processes determines the concentration of drug in body, the onset, duration, and intensity of the drug's effect. So firstly, absorption. The drug will be taken either orally either in forms of tablets or syrup. Upon administration, drug will be quickly absorbed, exhibiting a time to maximum concentration of roughly an hour in adults. Both tablet and syrup forms of dosage is found to have similar bioavailability, and the speed of absorption can be affected by the presence of food, but the degree of absorption remains unaffected. Moving on to distribution, cetirizine dihydrochloride doesn't go through first pass effect, so the volume of distribution is around 0.44 plus minus 0.19 liters per kg. Next, the metabolism. So 53 ml per minute is the total body clearance rate of cetirizine dihydrochloride. The plasma elimination half-life of this drug is 8.3 hours. Finally, we have excretion. Kidneys are primarily responsible for eliminating this drug in the form of urine. If patients are experiencing renal impairment or undergoing hemodialysis, a change of dosage must be done. Those taken orally will be identified in the urine around 70 to 85%, whereas in the feces to a degree of 10 to 13%.
Moving on, let's talk about the pharmacodynamics of this drug. Pharmacodynamics studies the biological effects of drugs on organisms. It mainly emphasizes on dose-response relationship. Pharmacodynamics along with pharmacokinetics influence factors such as dosing, drug benefits, and adverse effects. Cetirizine dihydrochloride displays general effects on respiratory symptoms. It is an active metabolite of piperazine H1 receptor antagonist, and it minimizes or eliminates the symptoms of chronic urticaria, seasonal allergic rhinitis, allergic asthma, and physical urticaria. Aside from the effects on respiratory system, it also displays effects on anti-inflammatory actions. For example, it plays a role in asthma management, it improves the condition of urticaria. Concomitant use of cetirizine reduces the duration and dosage of topical anti-inflammatory formulas used for the treatment of atopical dermatitis. The mechanism of action of this drug is that its main effects are achieved through selective inhibition of peripheral H1 receptors. By nature, Histamine binds to this receptor and activates a cascade of events leading to itchiness, runny nose, and watery eyes. Cetirizine blocks the action of histamine by binding to the H1 receptors to inhibit the release of chemicals that are responsible for triggering the allergic reaction. In addition to antihistamine properties, cetirizine also displays anti-inflammatory properties as mentioned before. It inhibits the migration of anti-inflammatory cells to the site of injury and reduces the release of chemicals that causes inflammation. Cetirizine is considered as a sedative antihistamine as it has a lower affinity for receptors in the central nervous system. Therefore, it helps minimizes the sedative effect. However, high dosage may cause side effects in individuals such as drowsiness and headaches. In conclusion, cetirizine dihydrochloride is an antihistamine that is used to treat allergic reactions, and it is readily available over the counter in many pharmacies. It is also relatively safe for vulnerable individuals such as pregnant women and children. Thank you very much.